In this video, we'll be unpacking Bob Marley's experience with malignant melanoma and taking on a holistic view to this diagnosis. Bob Marley, the Jamaican musician, unfortunately lost his life to malignant melanoma at the very early age of 36. Knowing the warning signs of this rare type of cancer, skin cancer, can mean life or death when it comes to diagnosing early and doing everything possible to prevent its growth. In case you're new to my channel, my name is Dr. Lori and I help you take on a metabolic approach to your cancer care. Now, melanoma is one of the most aggressive forms of skin cancer produced from the melanocytes in your skin, which is responsible for the pigment that gives your skin its color. And the ways to catch the skin pigmentation cancer and to see the warning signs is to look at the size, the shape, if it's changing, if there's pain to the area, if the lesion is over 6 millimeters, if there's any bleeding, or if the borders are irregular. Those are all symptoms and signs that you need to look into that further. Now, it's easy to see how Bob Marley missed those warning signs. When a dark spot appeared under his toenail, he just attributed it to a soccer injury. And I imagine he did not think it's serious and just thought that lesion would just go away. Now, the interesting thing about melanoma is there's a huge correlation to low vitamin D status and an increased risk for skin cancer. Now, how does that happen for someone who lives in Jamaica, who's in the sun all the time, and likely has high vitamin D status in his system? After 15 years of working as a naturopathic doctor, I'm actually very shocked about all of the cancer patients who have extreme low vitamin D status, despite living in sunny areas and being in the sun all the time. And the reason why is because there's a huge genetic component in how your body can activate this vitamin D from the sun or the foods that you're eating. So just because you live in a sunny area, you do not want to assume that your vitamin D levels are up to par. When I do deep dives with all of my patients and support them on their cancer journey, I make sure to get their epigenetics checked. So looking to see where their predisposed weaknesses are and how their body can activate this vitamin D3. CYP2R1 and CYP3A4 are genetic variations that affect how your body takes sunlight and converts it into 1,25-dihydroxy vitamin D3, also known as calcitriol. Most supplements that you find with D3 do have that activated form because they do not want to take the risk that your body's not able to convert it. So if you see any vitamin D products that are just D1 or D2, you do not want to choose those ones. You want to choose the ones that are in the activated form. If you're looking for someone to help support you in a metabolic approach to cancer and to make sure that your vitamin D status is up to par and to make sure you're taking all the things that your body requires based on your epigenetic profile, make sure to go to drlori.ca and we can chat about the many options and ways that I can support you. The other thing you want to be cautious of is how much and what type of sunscreen you're applying to your skin. Now, we know that excess burning and sun exposure is linked to a higher risk of skin cancer. However, there are ways to support your body without completely blocking the UVB light, which is responsible for activating and synthesizing vitamin D3. So in case you missed that, UVB is blocked by sunscreen. And when you block that, you do not synthesize vitamin D3. So if you are an excessive sunscreen user, you absolutely need to supplement vitamin D3 into your plan. Your skin is your largest absorption organ as well as your largest detox organ. So sweating is extremely important and avoiding all the things that can create more inflammation in the body. So on the topic of toxicity, I know for a fact that Bob Marley was a large marijuana user. And with all the research of CBD, you wonder how, with that much intake of CBD, could possibly there be such an inflammatory and cancerous process happening. So you need to be aware of the solvents and all of the chemicals that could be associated with cannabis use. One of my favorite things to use for malignant melanoma is chaga mushrooms. In chaga mushrooms, there's a compound called Betulinic Acid, which induces apoptosis and is actually cytotoxic to malignant melanoma cells. Chaga mushrooms can be drank in a tea or in a capsule form, and it has many anti-inflammatory properties as well. This is where you want to do a deep dive into your epigenetics and understand also what the best supplement plan and meal plan would be for you. So not everyone is the same, not every protocol would be the same. Taking on a metabolic approach is looking at all of those factors of how you're activating these nutrients and where you really need to focus your attention. I had a patient in the last few years who was on a very high protein diet because they knew that proteins and amino acids are essential for a healthy immune system. But interesting enough, if you have the ACSL1 SNP, then you absolutely need to avoid red meat in your diet, especially if you have a cancer diagnosis. For this patient specifically, we went on to more of a methionine restriction diet, introduced intermittent fasting, lowered how your body goes into this anabolic phase. When you're eating things that are actually creating more proliferation, that is directly driving cancer cells. So if I was Bob Marley's naturopathic doctor, I would make sure to take him off meat completely, switch to more plant-based. Before that even, I would check his genetics to make sure that is exactly what he should be doing. But generally, you would want to avoid the things that is sending your body into overdrive. His typical meals would be fresh fish, fresh vegetables, maybe juicing, just getting high nutrient dense foods into a system all the time. There's also a huge connection with thyroid and the activation of melanocytes and melanoma. Melanoma growth is actually activated by the anterior pituitary and the thyroid stimulating hormone. So we want to keep that TSH or that thyroid stimulating hormone as low as possible. So the more hypothyroid you are, as in the higher the TSH, that actually drives more proliferation. So we want to use things that help suppress that TSH level so we can keep those cancering cells at bay. And also take a deep dive to the adrenal glands, because we know if your adrenals are way out of whack, your stress glands are way out of whack, there's no way that your thyroid can be functioning optimally. In the next video, I talk all about Angelina Jolie and her experience with preventing cancer and what she did because of this genetic predisposition. Was it really necessary? In the next video, I deep dive into this topic.